The next section of this training will cover screening. The New Mexico Department of Health COVID-19 immunization protocol will be available to all clinical volunteers and staff who are participating in any Department of Health COVID-19 vaccination clinic. This protocol serves as your medical orders and must be adhered to. Please be sure to review this protocol before the day of the clinic and again on the day of the clinic. Some of the key areas to review in the protocol include this year's personal protective equipment requirements, the vaccine formulations, how to administer vaccine, the current schedule and dosage, contraindications, any adverse reactions, and proper storage and handling. Because of the highly infectious nature of COVID-19, we must ensure that patients are physically distanced at least 6 feet apart, that all patients over 2 years of age must wear masks. Cloth masks are okay. In addition, vaccinators must wear a mask, a face shield, and gloves. Be sure to check for the latest Department of Health recommendation and your organization's guidelines, as these requirements may evolve over time. Gloves, if used, should be changed between patients, and the vaccinator must wash their hands or use hand sanitizer before putting on new gloves. Surfaces that are touched by the patient, pens, clipboards, chairs, iPads, must all be cleaned and disinfected between patients. Next, we will go over the forms. A key component of a mass COVID-19 vaccination clinic is getting information quickly and efficiently from patients. Using an online registration form speeds up the process considerably and reduces the need to clean items between patients. There will still need to be a screening for COVID-19 symptoms before vaccinating at the clinic, but most of the patient information can be filled in ahead of time by the person registering. This also saves time and person hours entering information into the electronic medical record, and the Real-Time Solutions online program can upload directly into NMSIS. In some cases, paper forms will need to be used for those who cannot register online ahead of time for whatever reason. The link for online registration is available on the New Mexico Department of Health website and is being promoted widely. The link is cvvaccine.nmhealth.org. Another advantage of the online registration form is that the person registering must include all the necessary information, or the registration will not go through. Once a person registers and arrives at the clinic, their identity must be confirmed to match their online registration information. Only the person with the appointment should be vaccinated. There is not capacity at this time to accommodate walk-ups or non-registered accompanying family members. Before vaccinating, patients arriving at the COVID-19 vaccination clinic will need to be screened for any COVID-19 symptoms, for fever, and for possible contact with someone infected with COVID-19. This is in addition to the regular COVID-19 vaccine screening questions about anaphylactic allergy to any component of the vaccine or prior severe allergic reaction to a dose of COVID-19 vaccine. There are also several precautions that should be discussed, including pregnancy, breastfeeding, bleeding disorder, or severe allergies to medications or prior vaccinations. These are not contraindications, but should be discussed with the patient. Pregnant women should discuss vaccination with their healthcare provider, but they may be vaccinated against COVID-19, especially if they are in a high-risk category. Pregnant women were not included in the vaccine trials, so this is considered a precaution.